As listeners may recall, that Barack Obama was for reimportation and negotiated drug prices under the Medicare program. In the Senate bill, neither of those things will happen. In the House bill, those provisions are still part of the House bill, but the money is that the Senate bill will prevail on most issues. So I think it's probably not going to happen that those two things will be in the final bill.
Senator Lieberman and the effect he had on the Senate bill. And any relation, Trudy Lieberman?
No, no relation.
What about his effect?
He was very influential. In fact, he was really the pivotal person to kill the public plan in the Senate. In my post on CJR.org, I said he was probably the best lobbyist the insurance industry and the doctors and the hospitals could have had, because neither of those two groups of stakeholders were keen on a public plan. And I think that point has been forgotten. In the end, Lieberman held all the cards, and he said that he would not provide the 60th vote if the public plan were part of it. Obviously, he is from Connecticut. Connecticut is the insurance capital of the world, or of America, and I'm sure he was listening to his constituents in the insurance industry that did not want a public plan.
We're we're also joined by Democratic Congressmember Raul Grijalva joining us from. Well, he represents the Tucson area of Arizona, and he is the co-chair of the Congressional Progressive Caucus. Welcome to Democracy Now!, Congressmember Grijalva. Can you talk about how you're going to reconcile what the Senate just did moments ago with the House plan?
Yes, and thank you, and good morning. I think that reconciliation is going to be a very difficult process. I'm glad that we're going to have a formal conference where there will be an opportunity to try to fundamentally change what is in the Senate bill. And there's 4 or 5 cornerstones that are vital. Trudy just mentioned one that having to do with the reimportation issue, the repeal of the antitrust provisions that are in the House bill but are not in the Senate bill. And, of course, what is the public presence? What is the public option? What is going to be that mechanism that many of us fought as one of the last battles in the House to assure that we keep this whole process with a public presence that keeps it accountable and honest. A mandate that merely does not provide alternatives for people to many of us is destined for difficulty, if not failure. And so, you know, there's points of reconciliation that are going to be very, very difficult. I think, you know, the president said that, you know, he's shown that he can make unpopular decisions. Well, you know, now it shifts over to many of us in the House that are faced with keeping the ball rolling, per se, in terms of health care reform and extending coverage to millions of people, as is being touted in the Senate bill, or holding the line on some of the issues that we felt were vital to moving health care reform in some legitimate direction in this country. So it's going to be a difficult process, to say the least. And we hope that the conference, that our leadership in the House hangs tough on the things that were bitterly negotiated, on the things that we felt had to be part of a package in order for many of us to go along with it. So we're back in that position where I don't consider it 9/10 of a loaf. Do you take part of a loaf, or do you hold out and insist that some of the points that are vital to us are part of the package? And that's the tough road ahead.
Well, Congressman, you mentioned this 9/10 of a loaf. This is what President Obama now, in several interviews now in the past few days, has been saying, that he got 95% of what he originally said he wanted in this bill. Is your reading of that, of his estimate, accurate in terms of what he got versus where he started on health care reform more than 2 years ago, before he during the presidential primaries? Well,
when the whole discussion started around the issue of universality, that we had to have some universal system that included a strong government presence, a public option, a public presence, in assuring that we would keep insurance companies honest in the delivery of health care in this country. That part is out. And I thought that was central. That was the heart of it. Once single payer was off the table, we were left with defending and promoting a segment of it, which was the public option. With that out, with having mandates but no public option, with antitrust being eliminated in the Senate, with the tax surcharge being gone, with taxing health benefits for working folk, one can judge the percentages the way one can, but I see this as the Senate bill as a step back from what the House did. And so the reconciliation process and the process of conference is going to be vital to try to restore what I believe were some of the initial promises and commitments that many of us made to the American people at the beginning of this health care reform debate.
Well, we have Trudy Lieberman here, who's been following this very closely, saying that she doesn't have much hope that your version will prevail over the Senate version, that most of the Senate version will end up being in the final bill. Your reaction to that?
Well, there's some validity, obviously, to that statement. You know, the 60-vote threshold is something that is difficult to get, and then you put into the hands of one or two senators, whether it's Nelson, Lieberman, or whomever. You give them an inordinate amount of power to be able to dictate the content of even what comes out of conference. So, you know, some of the senators have stated if these things are put back in, then we can't support it. And I think we have to be strong in our presence, saying if these things are not in, we will have a difficult time supporting it. And it's not a question of who blinks first. I think there is also going to be public opinion that weighs into this conference process.
Congressman Grijalva, can you see yourself not voting for this bill ultimately?
If it comes out that what we are basically doing, and it's a difficult question, I mean, no question, no doubt about it. But if I end up being confronted with merely rubber stamping what the Senate does with no changes in terms of public accountability or a public option or a public presence in that plan, if we don't move up the dates to make sure that coverage begins immediately, if we don't really tighten down on the regulatory and put some teeth behind what we're going to do with private insurance companies, and we're just replicating and just rubber stamping what the Senate did, yeah, I would have a very difficult time voting for it.
In just 10 seconds, wrap-up comment, Trudy Lieberman, and when this bill would go into effect if it were passed.
Most of the provisions would take effect in 2014 under the Senate bill. A couple of minor provisions will take effect immediately, and there is some provision for people who don't have insurance now to go into high-risk pools with some subsidization to help them buy insurance.
We're going to leave it there. Trudy Lieberman, thanks for being with us, contributing editor to the Columbia Journalism Review, blogging on healthcare at CJR.org. And Congressman Grijalva, co-chair of the Congressional Progressive Caucus, we'd like to ask you to stay with us because we're going to look at immigration and the number of immigrants who are being detained now around the country. This is Democracy Now!, democracynow.org, The War and Peace Report. We'll be back in a minute.